Okay, this is NG insertion video. Some of the things that you're gonna need, you'll have your silk tape, your doctor's orders, your large syringe container, your NG tube, water soluble lubricant that will be provided, your pH strip, and we have that also, rubber band, safety pin, and your basin, and these will be in the top drawer of the bedside tables. So you'll come in and knock on the door, do your hand hygiene, provide for privacy. Hello, I'm Selena. I'm going to be your student nurse today. Can I get your name and date of birth? And then check your allergies. And so what we're going to do today is the doctor has ordered an NG tube insertion. So we're going to, have you ever had that before? And they say yes or no. If they haven't had one before, then just explain in words that they're going to understand. It's a small tube going into your nose, down your throat, and into your stomach, and it's going to help with your nausea and vomiting. So I'm going to go ahead and raise the bed, get it to a 90. You're going to stick, I want it as high as I need it for my height. And then he needs to be sitting up 90 degrees. I'm going to go ahead and sit him up. So I want to assess him, and so I'm going to ask him the question, is there a side of your nose that you breathe out of better? And take my pen light, and I would look in there. Have you had any nasal surgeries, deviated septum, nasal polyps or anything? And if they say no to everything. So if he says he breathes out of the right side better. So that's the side that we're going to use, is the right side. You always want to test your equipment before you get right in the middle of something. So I'm going to go ahead and put some gloves on. This tubing could be dirty, so I got my gloves. This is your pump, the pump, and then your canister. So you got regular and intermittent. So whenever I'm testing my tubing, I put my finger on the end of it, and that creates a vacuum. So I turn it to regular, I put my finger on the end, and you want to make sure that this dial is in between 80 and 120. If it's not, you just dial it in here. So I've got it in between 80 and 120, so I'm going to turn it back off. The doctor's actually ordered intermittent, meaning it comes and goes. So whenever I do get to this point, it'll go on this side. So I've got my tubing ready. I'm going to put my call light over here. Give him some tissues just in case you need it. I'm going to go ahead and get my items ready here. Get my tape. So I'll take a small piece, put it on the table, and that small piece is what I'm going to use to mark the NG tube whenever I measure it. I'm going to take another piece and rip it down the middle to where it looks, I call it the blue jeans. It looks like a pair of blue jeans. That's the one that's going to go on the nose, and I'll show you how to wrap that one. pH paper goes in the basin, and I'm going to set that in his lap, and then the rubber band and the safety pin we'll use here in a minute. I'm going to go ahead and open up my package, take my NG tube out. One thing, you'll have the blue part, that's the vent. Then you've got this other small piece, it's a connector. Don't lose that piece because you'll need it. And when you take it out of the package, just roll it around your hands. Remember, it makes it more flexible. Whenever you insert an NG tube into the stomach's under pressure, and if they're having nausea, vomiting stuff, if they've got something in their stomach, if you ever leave this open, and this part is inside of your patient, that gastric contents can go up this tube and shoot out. So right now, we're just going to go ahead and connect it together like that. While we're measuring, just a good habit to form right now. So we take the end of it. We're going to go from the tip of the nose, earlobe, and down to the xiphoid process. So that's where we're going to put a piece of tape, and that tells us about how far we're going to need to go down. I'll go ahead and tell you on these mannequins, it doesn't ever go to that spot, and that's okay. All of your instructors know that, but you're going to practice like you're on a real person. So it might only go down that much. So I've got my mannequin, and I've got my tube. So I'm going to get my little syringe here. Whenever I get it down into the mannequin or your patient, you're going to have to withdraw the gastric contents and check the pH. So we're going to go ahead and put the syringe on there and put it in there securely. If you're doing a feeding, if you're doing anything, nothing ever goes through this. This is a vent. So we don't ever, withdraw any contents or push any kind of feedings through it. I'm going to go ahead and get my gloves on. I've got my cup of water that he's going to need. Okay. So you got your lubricant, you'll open that up and you can just stick it about 1 to 2 inches in there. We're going to prepare our patient, teach them what we're doing. So whenever I start advancing this into your nose, if at any time that you need me to take a break, I want you to raise your left hand. Whenever I get to a certain point, I'm going to ask you to take a sip of water through the straw, and that'll help for the tubing to go down. So I'm going to go ahead and remove his little pillow because we want his head to kind of go back a little bit. So we'll go in his nose. So remember, he could breathe out of the right side, so we're going to go down that one. All right, so he's gone a little bit, so I'm going to take my pen light and I'm going to look in there, and remember, I want to make sure that the tube is going straight down in the throat. If it's curling around or anything, you would back it up and try again. So it's going straight down. At this time, you want to ask them to tuck their chin, okay? So I know on these mannequins it's not going to work, but he would tuck his chin, and he would take his little hand, and whenever he swallows, that's when we advance it. So sip, swallow, sip, swallow, sip, swallow, sip, swallow. So that force of swallowing helps it go down. All right, so there it is. So yeah, it didn't go all the way down to this tape. So I'm going to take my tape here, and you put it on top of the bridge of the nose. And you take one side, wrap it around. You want to make sure that when you tape this, you don't have the tube up against the nair because it'll cause skin breakdown. So there we go. He's taped, he's secured. Don't ever let go of it because that thing will shoot back out and you got to start all over. So now, remember, we've already got set up for our syringe for checking pH. So right now, what we're going to do is we're going to draw back, and we just need a drop, okay? Always crimp this off. Put it on your pH paper, and we're looking for a pH of 1 to 5. Put your syringe back on there. And now we're going to listen for the splish. These are two different ways to verify placement. So I'm going to listen down here in the stomach area. And so whenever I push, you're going to hear either a gurgle or air movement or something. So we've verified placement two ways. Clamp off your tubing. So we don't want that stuff on us. Take your syringe off. And we're going to go ahead and take that clear right here, the clear adapter. And then this is what your suction tubing goes to. There's that on there. So you always have to be mindful of whether or not you're sitting there jerking on your patient's nose. Alright, so now I'm just going to set that there. If my gloves are dirty, I would change gloves. This little rubber band, we want to give them enough movement if they turn their head. You know, you don't want to pin it down to here. Give them slack. Put this rubber band on there. And then this will pin to the gown. You just kind of loop it through. We'll have to show you in person. You take that pin, you go through the loop of the rubber band, and this is going to go on the gown to anchor it. Some people will use a piece of tape and pin it on there. And then we want the vent to kind of stay up here. So I'm going to take my basin. I don't need the tissues anymore. Or the water. So remember, his orders say low intermittent suction, wall suction between 80 and 120. We'll go ahead and lower the bed. You always want to at least keep the head of the bed at 30 degrees at all times. Go ahead and take my gloves off. Wash your hands. I'm going to go ahead and take his pillow, give it back to him, ask him if he needs anything. We can lean him back just a little bit. Right up there. And then assess your patient, see if they're comfortable. This little blue band, you can just tuck it behind his pillow. Keep it out of the way, but keep it higher. I'll be back to check on you, and also I would note the characteristics and the amount that is sucked out at this point after you turn it on. So patient's good, bed's down, he's got his call light. I would put the curtain back, hand hygiene, and exit the room.